So we're here today, another insider call. We got an extremely special guest. This is one of those topics that you see on the big screen, you talk about a lot, you hear about a lot, but very often do you have an expert. So we'll give Alex the opportunity because he knows how to pronounce not only this gentleman's first name, but also last name. So Alex, kick it off you to turn things up and get us started.
Aaron Magareggi, we're so excited to have you. I feel like I'm gonna be personal. I think I'm like a general hypochondriac where I'm scared of some things, both personal health and I'm just general fearful of a lot of things in life, fireworks, trampolines. There's a whole slew of things I'm scared of. And I feel like cybersecurity is something that I should be scared of. And I think throughout this conversation, I'll probably be even more scared of. And so you're an expert lawyer, AI, innovation, all these things that we're going to learn about. We're going to jump right into the questioning and then we'll kind of go in reverse order. We'll hit some hot topics and then get to sort of how you are, where you are, and what your advice is for others. The biggest thing, just seeing like name and title and position that you have, um, the biggest thing that I can imagine is what's on the news with Change Healthcare of like all cybersecurity. And I think there's even like national security implications to this. There's clearly some policy sort of thoughts that a lot of people have of like, why does the payment flow to providers only go through one or two or three companies largely? And I think the biggest question right now is like, could this happen again relatively quickly? Will it happen again? Is it going to like, what's all this about? So I'm sure you've heard this question, but I would love to hear your take on just what we're doing from a flow of money to providers and how terrifying that is when it slows down for whatever reason it slows down.
Yeah. So first of all, thanks for having me. And your question's well taken. I think people are a little confused of where sort of this latest incident sits in the ecosystem of healthcare. And I deal a lot in HIPAA and a lot in privacy, and everybody knows the definition of a covered entity is either a health plan or a payer, but there's actually a third prong of that definition, and it's called a clearinghouse, right? And it's sort of that intermediary that that receives the claims, scrubs the claims, passes the claim through to the payer. And you mentioned Change and the incident that they've been experiencing. Change is one of those intermediaries. They're one of the clearinghouses. They perform a lot of other services. They're a big player in the industry, but that is where they sit. They sit right between the payer and the provider in terms of the payment flow. So I think your question, really more general in nature, is hey, can this happen again? So if you've been in this arena long enough, you sort of know the answer to that is yeah, it can definitely happen again. I think that there's a lot of uh, actors out in the environment right now that are looking at healthcare data. Everybody knows it's the most valuable of the personally identifiable data out there. Every year, there's a bunch of different studies which try to quantify how much every single health record is, and sometimes you see it's $500, $600 a record per record. So you hear these big numbers that happen in these breaches every day, and it's a million people, 2 million people. Well, multiply that by 600, and you can see where the value is in that. And so, not to scare anyone, but yeah, it certainly can happen again. And right now there seems to be more of an uptick than usual. I've seen a couple of alerts from the federal government, and specifically the FBI has put out some alerts on the types of ransomware that have been out there. And certainly folks in this space, in the healthcare space especially, need to be on the lookout for it.
Fascinating stuff. I can just hear from your tone and Alex's concern that this is probably just the beginning, not going anywhere. I want to take a step back, if it's okay. In your current work, just give us the story, how you ended up here, what keeps you going day to day? You know, we all know the big players in cybersecurity, whether it be Microsoft or Palo Alto or CrowdStrike. Why healthcare? Why now? And, you know, just for the audience that may not know anything about, you know, the work that you do day in and day out.
Yeah, so I'm lucky in the fact that I get to do what I love. I'm a lawyer by trade. I'm a healthcare lawyer by trade. My career's a little bit backwards in nature. I started out at a small law firm, and then I actually went in-house at a large Medicare and Medicaid health plan. So I spent 5 or 6 years in the business side, which probably the 5 or 6 years most enlightening 5 or 6 years of my professional career. Kind of learned the ins and outs of the business, and worked a lot with some great executives and a great executive team, and rode a great wave with a great company. While I was there at the health plan, sort of the call it the rise of HIPAA, the implementation of HIPAA is going on. We're talking early teens, and in its sort of current iteration. And so I sort of became a subject matter expert, and worked a lot with the innovation team, the privacy team, cybersecurity team. So kind of always had my hand in sort of the technology aspect of healthcare. And after 5 or 6 years at the health plan, I really wanted to go back and do it at a bigger scale, work with both big institutional clients, but also startups, folks that are really trying to move the needle. And let Foley, I'm in Tampa, Florida. I'm a partner in their Tampa office. I call myself a digital health lawyer, and that's because 100% of the day, 100% of the time, I am working with healthcare companies that are looking to digitize the healthcare process. Whether it's the front desk process, whether it's the actual delivery of healthcare. We do a lot of work with therapeutics, emerging companies and technologies, and really just where healthcare meets technology. That's where I like to sit. So, if you're talking to me, you're likely in the digital health world, and you're likely looking to streamline, make something more efficient, make something, really engage with your patients. I fancy myself a patient engagement lawyer. So a lot of companies come to me to help engage with their employees. I mean, we've kind of, or employees, patients, whatever the crowd may be. We hear a lot about, just kind of my day to day. We hear a lot about great telehealth. It's meeting the patient where they're at, making it more convenient. Digital health, same kind of concept. And what I think some of the early adopters found out was, yeah, it's great to get in network with a health plan, but now you actually got to go find those beneficiaries. And so that's what I do. I help our clients sort of go to where their patients are at. And we work with some great companies and some great clients, and it's so very exciting. So I do about I would say 50% of that, the good guy stuff, where I'm there and helping folks connect. And there's a small portion of my practice that still deals with sort of some of your traditional healthcare stuff, payer provider agreements, and things like that, but still with digital health companies. So it still stays in the same arena. And then sort of as we started the conversation, the data protection aspect of this, right? Hey, I just got hacked, or I think I'm going to be hacked, or I think I might have been hacked, and can you help me out? And yeah, that's my day to day. It's always changing, it's always interesting, but I think that's healthcare, and I think that's why I got in healthcare, because I wanted to hear and see what the nation's smartest, most motivated people were doing, and it certainly hasn't disappointed.
I mean, we certainly agree and constantly defend the people in healthcare. And so saying the nation's smartest, and we think just the constant sort of ask to us is healthcare needs the best people. And so it's constantly trying to say, hey, there's some real challenges in the healthcare ecosystem, and we need the best people to be trying to solve them. So love to hear you say that. I think we're legally obligated anytime the word digital health is used that you have to say AI. in conversation at least 4 times. And so we'll ask the AI question. As I'm sure you see it on I think a lot of the discussion around AI is on that kind of patient engagement side and patient communications. And you mentioned the sort of back office kind of automation of work, back end type functions. AI in healthcare, is it more hype than reality right now that you're seeing in practice? Are the regulations that are being put in place too aggressive, too lenient, not enough, right place? What's your sort of take on the whole AI hype cycle revolution?
Yeah, so if you know me well enough, you know I'm a pessimist by nature. I will tell you though, I'm a big fan of AI. I think it is here. I don't think it's as here as much as we maybe see at those conferences and some of the pitch decks I see, but it is here, and so. I've seen a lot of adoption in really in two spaces. You mentioned the back office space, but I've also seen it in like the clinical decision making area. And so both are fascinating to me. Both of those areas are just they're still ripe for disruption. It's such a cliche statement, but they really are. You think about just some of the common, products that we've started to see out in the market. Digital scribes, assistance with prior authorization, automating that process, and then on the clinical decision making side, really moving the needle from just a if this then that to a more of a the inclusion of generative AI, and so I think it's here. I think we are in the process of refining it and drilling down on it. And really figuring out what the use case is. And you bring up a great point about the regulation. I think a lot of people think that there's a ton of laws out there that are going to regulate this, and the truth is there really is, but some of them have been existing for 30 years, and I'll give you a great example. What's the lifeline of AI, right? It's data, and anytime you're talking about data in the healthcare industry, you're talking about HIPAA, and so here we have a 30-year-old law that has been updated a couple times, but really not substantially since 2013, and that's the main law that's going to govern the uses and disclosures of data as it relates to AI. And some of those things don't really match up, right? Your people weren't thinking about the fact that there was going to be algorithms running through the data and producing all of these great outcomes, and really just how much computing power is really out there at this moment. And so I think on the back office side, it's a little bit easier for us, us lawyers, right? The dumb lawyers in the room to figure out the laws, because the back office stuff is, you're dealing with licensing and HIPAA and data uses. What's more fascinating to me is the clinical aspect. There's a couple states out there, usually medical boards, that have put out guidance on AI. And, I think if I had to like sum it up in a nutshell, I think what I've seen out there from the guidance is that medical boards, they say, hey, we love AI. We're big on AI. Doctors, if you use AI, the decision and the onus is on you to make sure you're using it right. So, is that the right way? Probably for right now it is, but that conversation is going to change as the technology gets better and a little bit more reliable.
Living it now, especially for our doctors that see themselves on the cutting edge and attend conferences, etc. They're always bringing back the bright, shiny tools and asking us to give them full autonomy to use it. So safe to say that you have a solid, safe job. So,
Hope so.
we at the Advancement League, we call ourselves healthcare optimists. So you said two things. One, you said naturally you're a pessimist, and then you said you used the word guidance, and those two triggers that I have to ask this question. So the context I'll give is that one of our advisors, during his time as CEO of a hospital, he told everybody at scale that his main job was to work himself out of a job. His job was to make everyone healthy enough to where he closed hospital beds, etc. So sounds good. So asking you a similar question. All the work that you're doing, the things that you're reading, if you had to pull the silver lining and kind of give our audience a positive outlook, what would you say? What is the kind of positive about all these opportunities? If you were to hit the lotto and never have to do the work that you're doing now, are you seeing anything that gives you hope that this thing is going to sunset here in the next 10 years?
Yeah. Um, I think I think the answer to that question is that it's all positive. I've never negotiated an agreement between two parties that were looking to do something negative, right? And think about the digital scribe, the AI scribe scenario. We're creating that to free up doctors, to make them more efficient, to reduce burn on them. Think about some of the tools, the clinical decision-making tools that we've seen come out in the recent couple of years. It's looking to give doctors more tools to assess and to provide better care to their patients. Think about some of the research capabilities now that the some of this tech and some of these platforms that we've seen out there have been able to create. So, in 5 years ago, 10 years ago, your clinical research studies were really being done at the top hospitals in the country, and they're still being done there, and rightfully so. But sort of those medium-sized hospital systems that have patients that are just as sick and that have the same sort of inclusion and exclusion criteria as those bigger hospitals, they now get a bite at the apple because of the fact that technology has made data more accessible to people. And so, you asked me what the silver lining here is that it's all positive. Sure, there's things that, we have to work on and we have to fix, but I've never negotiated an agreement between two parties that are looking to do something negative here. And so that's my silver lining. Everybody's looking to move the needle, looking to improve, our nurses and our doctors and our clinicians and their work-life balance, and at the same time also looking to improve the patient experience. So I think it's all silver lining. I really, even on those tough negotiations where you're sitting there across a worthy adversary, everybody's moving towards the same goal, right? And so that's what I take away from all of this.
You mentioned the price of individual medical records, and maybe it's like the black market price or whoever sets that price.
Sure.
And then you talked about HIPAA and some of the security standards behind it. Sometimes we talk about that there's a lack of big ideas in healthcare, as it seems like most of the ideas are very incremental, are very sort of process oriented, a little bit faster, a little bit better, whatever it is. But there's not really revolutionary ideas that we see very often. To your point of like seeing pitch decks, because we don't really see pitch decks that really are changing anything. They're usually selling to the current system. One of our friends has an idea that he ran by us that was the value of your medical records and data is more valuable than the monthly premium that you would pay into insurance. And so his theory was if you could sign over your rights to, you can use this data to experiment on whatever you want, to run studies, to do whatever is the most valuable with that data, that he thinks consumers would sign over their rights and you'd have a free, you wouldn't have to pay into your premium monthly for health insurance. And that would sort of upend the system as the data is more valuable than your dollars. I would love for you to educate us on this. My sort of basic assumption was if the data is valuable, maybe it's already being used or paid for in a way that wouldn't make sense to pay the consumer for it, because then they'd have to pass along the savings or whatever they're making now. So your thoughts on that grand idea and where it fits into the legal possibilities and sort of what you see with both HIPAA and patient rights and concerns and value in the real dollars and cents.
Yeah, so this is a loaded question for me. So your friend's on to something. I've heard some similar concepts that treat data more of as like an opt-in sort of, hey, this is my data now. You have to remunerate me for using it for what I've provided it to you for. I've heard a couple different iterations, and I think they're fascinating. And you know, I I'm one of those folks that think subconsciously people trade data for convenience. And so, you know, uh, I bought a pair of shoes I didn't even know existed, a week ago because I was on some, Google search site and was looking for a pair of shoes, and lo and behold, they've retargeted my browser a few times, and I bought those shoes because they stuck out to me, and I'm really happy with them, right? And so that was my exchange, right? Somebody took my data, and I got the convenience of not really having to look too hard for a pair of shoes. I think a lot of how we're set up here as a sort of a healthcare market is the same thing. There's you know, digital health, I think in some cases, from a data use perspective, gets a bad rap, right? We hear about pixels and trackers and, companies sharing data with Facebook, and of course there's limits, and we always hear about the bad actors, right? The ones that share too much data, or too much information. But at the same time, I challenge some of those thoughts, because from my perspective, if everyone goes online to get educated now, right? If everyone goes online to learn about their maladies, or learn why they're not feeling well, or learn where their closest healthcare provider is, that's the equivalent of 20 years ago driving down the road, looking up and seeing the sign on the side of the road that says, this is Dr. So and so, come in here. And when you sort of think about it like that, it's like, okay, I've moved from the highway to the information highway, right? I'm on the internet, and I'm trying to figure out where to go get healthcare. And so, you know I I get I totally, like I started the conversation here, I totally get the aspect of, I don't want my personal sensitive data, how I'm feeling about things, where my head is at from a mental health perspective, being shared with, a social media company, or a sort of analytics company who's going to build a profile on me. But by the same token, I also want to learn about these new innovative ways to receive healthcare. And so I think that's the line that, us as policymakers and influencers and thought leaders have to walk. We have to understand where patients are going to be, and we have to meet them there, right? It's not all that different than whoever came up with the idea of putting, the wait time for the urgent care facility on the billboard. It's the same concept. Somebody said, what matters to the person looking for healthcare? It was how long they have to wait. And now it may be a little different. What matters to the person wanting healthcare? It's that, well, they can read about it on social media, or they can, Google a blog about it. And so, data has value regardless of how much each record is. Data has value regardless of um, what an aggregator is willing to pay for it. Its value is, what are what are you using it for? How can you use it to your benefit? And then ultimately, you know, what's that data going to be done? How's that data going to be used to help you receive better health care? And in some ways, I think that messaging gets a little bit lost in sort of some of like the bad press of cybersecurity breaches, and pixels and trackers, and that type of news, sort of newsreel.
And full fireside chat. Or you've brought the fire. We always say that we wish we can have these conversations all day. So my last comment won't be a question; it'll be an invite. With our friends from Deloitte, Austin Chang, who does digital health for healthcare companies and hospitals across the country, and a host of others, we're hosting a summit. But a part of that summit, we're doing a small roundtable. Deloitte really wants this to be a 1 hour interactive workshop that translates into a white paper. And I could not imagine having that conversation without you in the room. So You mentioned Tampa, Florida. I know they haven't quite built the bright line that goes from Tampa to Miami, but we got to have you in the building for the Young Careful Leader Summit. We'll talk more, but May 16th to 17th, that is my last comment, is to try to get you there. So I certainly appreciate the energy, the insight. I've learned a ton, and I think our audience will truly benefit from this, and even more so in person. So we gotta figure out how to make it happen.
Absolutely. As long as you're offering a basketball game, I'm there.
Okay.
Ooh,
Say no
all
more. Alex
right.
is a scratch
Might
basketball
have to
player.
come out of retirement.
Awesome, man. Well, this is fantastic. We'll keep it going. Um, and last one is, how do folks find you if they're either already in a company, starting a company? What's the best way to reach out to you, lean on your expertise, and even work with you all over at the company?
Yeah, so yeah, one more time. I'm at Foley and Lardner. It's www.foley.com. My email address, I will spell it for you because it's a long one. It's AMAGUREGUI at Foley.com. You can find me on LinkedIn, Twitter. Twitter is at CISSP_ESQ. And yeah, I mean, shoot me an email, shoot me a phone call. I love to chat. I love to talk shop, and always happy to be a sounding board for ideas or for a good conversation. So it was really nice. I really appreciate y'all inviting me here.
Awesome,
This is
awesome.
awesome. Thanks so much, Aaron. I'm a little bit smarter and a little bit more scared, which is, I think, a good thing.